Sahmyook Health University celebrates its 90th anniversary. For the past 90 years, our university has worked together with local communities and contributed to national development. Today, we stand at a pivotal moment of new growth and transformation. Under the slogan, 90 years together, 100 years ahead, we are committed to expanding an even greater vision for the next generation. In this presentation, we will share the achievements built upon our 90-year history in 2025, along with our strategic plans for a new leap forward in 2026. Through strengthened collaboration with the local community, educational innovation, and global advancement, we will work together to create a healthier and more sustainable future. As a key institution in Seoul's RISE initiative, Sahmyook Health University is advancing 4 major strategic priorities: addressing regional challenges, nurturing future talent, enhancing lifelong learning, and developing highly skilled professional workforce. Through these efforts, the university is building a sustainable regional innovation ecosystem in which both the university and the local community can grow together. In particular, through industry-academia research, collaboration-based empirical studies and projects, the university is directly tackling social, industrial, and everyday life challenges in the Seoul metropolitan area. In addition, we have established a systematic cooperation framework through MOUs with local institutions, enabling structured and long-term partnerships. In 2025, our university achieved significant and measurable outcomes through the RISE project. In the area of addressing regional challenges, we successfully completed 11 projects with 200 local residents directly participating. In the area of nurturing future talent, 132 students took part in credit exchange programs, and 27 participants completed the Skin and Hair micro-degree program. In addition, 100 individuals participated in competency-building training sessions. We developed 36 programs and delivered 53 program offerings, further expanding our educational impact. Moreover, we signed 10 MOUs with local institutions, strengthening the foundation for sustained collaboration. These achievements clearly demonstrate the meaningful and practical impact our university is making in the local community. The year 2025 was a meaningful period in which we successfully laid the foundation for the RISE initiative. On March 1st, we launched the RISE Task Force team and began preparations for 4 key projects. On March 12th, we formed a 5-university consortium consisting of Samyuk Health University, Samyuk University, Hanyang Women's University, Baihwa Women's University, and Seoul Women's College of Nursing, establishing a strong framework for collaboration. Later in March, the consortium was further expanded to include Joohee University, broadening the scope of partnership and cooperation. On April 9th, we submitted the project proposal, and on June 16th, we conducted a mid-term performance sharing and review session to assess progress and ensure alignment. Finally, on December 12th, the 4 projects were officially selected, and we are now preparing for the official launch scheduled for February 10th, 2026. This entire process reflects the results of systematic preparation and strong collaborative efforts. The data-driven, customized health awareness improvement program for local residents is a core component of our university's regional challenge-solving initiatives. First, we scientifically assess the level of health awareness among community members through resident surveys. Based on the collected data, we then design and implement tailored educational programs and campaigns. Through this approach, we go beyond simply providing information and instead drive tangible improvements in residents' overall health awareness and well-being. This data-driven strategy maximizes the effectiveness of the program and enables the delivery of customized services that directly respond to the real needs of the local community. The rapidly increasing issue of obesity among middle-aged adults has become a critical health challenge in the local community. In response, our university has designed a community-based, lifestyle-oriented obesity prevention program to directly address this concern. The program primarily targets women around their 50s, supporting healthier living and sustainable weight management. Rather than simply providing diet-related information, the program adopts an integrated approach that includes lifestyle improvement and psychological support. It has been carefully designed to reflect the real daily routines and living patterns of local residents, ensuring that the activities are practical, relatable, and impactful. The mental health crisis among young adults has emerged as a critical challenge at the societal level. In response, our university operates a youth-centered recovery support program specifically designed for young people identified as being at risk of mental health crises. Through personalized counseling provided by professional therapists and emotional support programs, we promote psychological stability and actively help young adults return to a healthy and sustainable daily life. This program also emphasizes early intervention to prevent the worsening of crisis situations and ensures continuous support throughout the recovery process. Older adults with limited access to digital information and weak digital literacy often face significant challenges caused by the digital divide in today's society. To address this issue, our university operates a community-based digital competency enhancement program for seniors designed to strengthen their ability to access and use digital information in everyday life. We provide an integrated set of initiatives aimed at reducing the digital divide, including user-friendly public website improvement consulting, digital citizenship education for youth, and media literacy education. Through these comprehensive efforts, we support older adults in becoming active and independent participants in the digital society, ensuring that they are not left behind. The ESG-based resource circulation system implementation program aimed at promoting energy-saving habits and reducing carbon emissions among local residents represents our university's responsible response to environmental challenges. As part of this initiative, we conducted an energy usage assessment across 30 local sites, including community centers and schools. Through this survey, we identified the region's current energy consumption patterns, proposed practical energy-saving strategies, and developed concrete action plans to support the realization of carbon neutrality. The results are being utilized as foundational data to advance sustainable development within the local community. A representative best practice of the ESG-based resource circulation system program is the Green Wednesday campaign. Built on collaboration among the private sector, local governments, and academia, this campaign has established a practical model for ESG implementation. Specifically, we are partnering with 14 local cafes to promote the use of reusable cups and encourage sustainable consumption. In addition, 14 neighborhood community centers are conducting waste separation and recycling education, delivering life cycle carbon neutrality education designed for all age groups and demographics. Furthermore, we are expanding resource circulation stations, a community-based recycling infrastructure model to encourage everyday participation. The campaign aims to engage 3,000 citizen participants, helping to embed a sustainable culture and environmentally responsible practices within the local community. The university strengthened ESG culture and generated social value through various participatory programs. The ESG awareness education and upcycling campaign was conducted 3 times with 210 participants, contributing to the discovery of waste-to-resource ideas and the enhancement of environmental sensitivity. The support program for visually impaired residents in Dongdaemun achieved 100% satisfaction with 26 participants, and in collaboration with the Department of Beauty Convergence, provided professional beauty and photography services as an ESG-based community contribution model. In addition, the Suksak recycling campaign collected 29 unused items, raising awareness of circular resources, while the environmental plugging activities directly improved the local environment and promoted a culture of practicing environmental protection. The Resource Circulation Hub has been established as a community-based ESG center, serving as a key platform for embedding ESG practices across Dongdaemun District. Since its official opening on August 26, 2025, the hub has built a cooperative network with local institutions to create a solid operational foundation for spreading ESG engagement. Linked with the RISE initiative, it has also achieved stable performance by collecting and recycling an average of 150 kilograms of household waste per month. In addition, the hub has operated upcycling and separate disposal education programs with participation from over 700 students, faculty, staff, and local residents, strengthening hands-on ESG learning and fostering a sustainable resource circulation culture within the community. Sahmyook Health University dispatches overseas volunteer teams to various countries in order to practice global service and international cooperation. We sent 17 students to Uzbekistan, 19 to Kyrgyzstan, and 18 to Kazakhstan. In addition, 20 students were dispatched to Nepal, 19 to Sri Lanka, 15 to Taiwan, and 15 to Oman. In total, 123 students participated across 7 countries, strengthening their capacity as global citizens. During volunteer missions lasting approximately 2 to 3 weeks in each country, students engage in a wide range of activities, including cultural exchange with local communities, medical volunteer services, and educational support. Sahmyook Health University invests an annual budget of $10,000 to support community service and international cooperation. In 2025, this funding enabled us to provide assistance to 600 households. Even more noteworthy is our expanded goal for 2026. The university has established a plan to support 1,004 households in 2026, representing a 67% increase compared to the previous year. This substantial expansion demonstrates our strong commitment and sense of responsibility toward community service. Beyond simple charitable activities, it reflects a strategic approach aimed at addressing structural challenges within the local community and contributing to its sustainable development. On August 25, 2025, Sahmyook Health University was officially designated as a training university for foreign caregivers. This designation is valid for approximately 2 years and 8 months, from August 25, 2025 to December 31, 2027. The significance of this designation is substantial. In an era of demographic crisis, it enables the university to contribute directly to national policy efforts while strengthening its status as a leading institution in education and training within this field. In particular, by taking the lead in cultivating care and nursing support professionals through the Department of Global Care Services, the university is actively addressing one of the most pressing challenges of an aging society: the growing shortage of skilled caregiving personnel. In 2026, Sahmyook Health University has established 4 key strategic goals to achieve more dynamic and accelerated growth. These goals encompass our commitment to educational innovation, leading regional development, strengthening global capabilities, and advancing sustainable development. Each goal is supported by clear performance indicators and concrete action plans, and will be driven by mobilizing the collective capacity of the entire university. Through these efforts, we expect that our university will make even more meaningful and tangible contributions to the development of the local community and the nation. The new decade beginning in 2026 will pursue more innovative education, deeper collaboration with local communities, and a broader global impact. Thank you.